So chapter 13 covers the eye, ear, nose, and inhaled drugs. So eye medications are also called ophthalmic or ocular or optic. These can come in the form of drops or ointments. We use these for problems like glaucoma, which is a buildup of pressure, or we use them for infections, or to reduce redness, or to add moisture. So some general rules for eye, ear, and nasal meds are to wash your hands first, wear gloves, use only the dropper that came with the medication. Don't let the dropper touch the eye, ear, nose, face, or other body parts. And use a separate bottle or tube for each medication. Make sure that you follow your skills step by step for each of these types of meds. Your textbook, again, has instructions on how to apply these meds, but your skills book is your Bible. You might see abbreviations like OD for right eye, OS for left eye, and OU for each eye, but these are not approved anymore. If you see these, make sure the nurse gets them changed to say right eye or left eye or each eye or both eyes. Again, we do not use those abbreviations anymore. So those need to be changed. Don't even study them because I have a lot of students that still study them just in case. And then when they see questions like this on the exam, they choose a specific eye or something like that, when really the answer is to have the nurse change it. We do not use those abbreviations. Just another general tip with eye, ear, nose, and inhaled drugs. One medication is only for the one patient. So what I mean by that is, like, if you have a bottle of eye drops or an inhaler or whatever, it is not for multiple patients, even if it is something that's over the counter or whatever. It is only for one patient. So if you have multiple patients that are on the same over the counter anti-redness eye medication, for example, you need to have one bottle for each patient. And that's one of those things where I feel like that should be a self-explanatory thing, but I have definitely seen people using one resident's eye drops. That's usually the most common. One resident's eye drops for multiple patients, and that is not okay. So make sure only for one, we're only using them for one patient. So ear meds, these are termed OTIC. Don't get that confused with optic for eye meds, okay? OTIC for ears. We use eardrops for infections or to help loosen earwax. Drops are instilled or placed drop by drop. Again, make sure you use your skills book for this step by step on how to give eardrops. And the term nasal means nose. We use nasal drops or sprays for a variety of reasons. Again, make sure to use your skills book for the details on how to give these, and they are for one person only. When we're giving these different medications, we also want to make sure we are doing the number of sprays or the number of drops appropriately. A lot of people think that more is better, and that is definitely not the case. So we want to use the exact prescribed amount of drops or sprays or whatever we're giving. And in Arizona, you're not allowed to give inhaled medications. So the only thing I'm going to say about these is to make sure that if you see a medication that is INH or inhale on the MAR, you get the nurse to give it. Even if the patient has an inhaler at their bedside for their own use, again, you are not to be observing the use of that or documenting it in the state of Arizona. And I know that that is a very quick chapter, but that's all I have to say. Again, your book does go through the different procedures. The chapter looks a little longer because of the different procedures, but use your black book that you have for lab as your Bible as far as your step-by-step instructions go.